Thank you for joining us for today's presentation. Youth and Marijuana will give us a better understanding of youth marijuana use and the concerns surrounding it. Here is today's agenda.
Marijuana is a mixture of dried, shredded flowers of the cannabis plant. It goes by many different names such as weed, pot, herb, and grass. Marijuana can be smoked, used to brew tea, and mixed in foods.
Marijuana is psychoactive. In other words, it changes how the brain works. Marijuana affects specific sites in the brain called cannabinoid receptors. These receptors send messages to different nerve cells throughout the nervous system. They affect brain areas that impact learning and memory, appetite, coordination, and pleasure, so interfering with these receptors can have significant effects on our body. The main mind-altering chemical in marijuana is THC. Marijuana contains more than 500 chemicals, including more than 100 compounds that are similar to THC. The amount of THC in marijuana determines its potency or strength and how it can affect the body. Marijuana growers have been increasing the THC content of marijuana over the past few decades. Unlike THC, CBD does not make a person feel stoned or intoxicated. That's because CBD and THC act in different ways on different receptors in the brain and body. CBD can actually lessen or neutralize the psychoactive effects of THC depending on how much of each compound is consumed.
Concentrates are the products extracted from the marijuana plant and generally contain very high levels of THC. Some examples of concentrates are butter, shatter, wax, and butane hash oil. Edibles are food products infused with marijuana. Smoking is the most popular way of consuming marijuana, with the mind-altering effects taking only minutes. However, it can take 1 to 3 hours for a person to feel the effects because the food is absorbed into the bloodstream. This lapse in time between eating and feeling the effects leads to users eating larger amounts, thinking that the drug isn't working. If eaten all at once, the psychoactive effects may be slower to appear but may be severe when they do.
Marijuana is addictive. Like other drugs, not everyone who uses marijuana will become addicted. Who develops an addiction to marijuana depends on these factors. Our genetics, if someone has a close relative like a parent or grandparent with an addiction. Our age of first use. Our brains are not fully developed until our mid to late 20s. Alcohol and other drug use before the brain is fully developed can interfere with the way the brain develops. Those who begin using before age 18 are 4 to 7 times more likely than adults to develop a drug problem. Easy access of the drug. The easier it is for someone to access the drug, the more likely they are to use more and more frequently. Your home and family life, your peers, you are more likely to use marijuana or other drugs if those close to you are also using. And then repeated use. Continuing to use just keeps priming the brain. Marijuana affects each person differently depending on their biology, the THC potency, previous experience with drugs, the way a person uses the drug, and the use of alcohol or other drugs at the same time. Some people feel nothing at all when they use marijuana. Some feel relaxed or high. Others suddenly get anxious and paranoid. This happens especially when a person uses stronger marijuana, takes too much, or isn't used to taking it. Those using marijuana may experience learning and memory problems or sleep problems for months or years after they stop using. How long this lasts depends on the length of use, when the person started using, and the THC potency used.
Long-term effects include risk of addiction, long-term learning and memory problems, chronic cough, bronchitis, schizophrenia, severe nausea, and vomiting.
Someone who smokes marijuana regularly may have many of the same breathing and lung problems as people who smoke tobacco. For example, marijuana smokers can develop a daily cough or have a higher chance of getting a lung infection. Like tobacco smoke, marijuana smoke has a toxic mix of gases and tiny particles that can harm the lungs. Although we're still learning if marijuana causes lung cancer, many people who smoke marijuana also smoke cigarettes, which do cause cancer. Also, smoking marijuana can make it harder to quit smoking cigarettes.
If you inhale secondhand smoke, it is unlikely you would fail a drug test, but still possible. It is more likely to give someone a high if they're in an enclosed space with others smoking marijuana with high THC levels. A recent study showed that secondhand marijuana smoke can affect heart and blood vessels as much as secondhand tobacco smoke. More research is needed, but we do know that marijuana smoke can especially affect children and people with asthma.
Vaping is not a safer option. You are still inhaling various chemicals when using a vaporizer. In addition, vaping contains toxic chemicals and possibly toxic metal particles from the device itself.
People who have taken large doses or used marijuana with high THC content may experience brief psychosis. Psychosis can affect the mind and make it hard for a person to understand what's real and what isn't. A psychotic reaction usually goes away as the drug's effects wear off, but disturbing memories can remain. Some people have a gene that may increase the chance of long-lasting psychotic disorder, such as schizophrenia, a severe mental disorder that affects thoughts, feelings, and behavior when they repeatedly use marijuana.
While there are no reports of someone dying directly from marijuana use, it can still cause serious health problems. Some people have psychotic reactions that can lead to dangerous behaviors. Others may have uncomfortable side effects from marijuana, such as shaking, nausea, vomiting, lethargic, leading them to seek care in an emergency room.
The effects of marijuana usually last from 1 to 3 hours, but marijuana can stay in the body for days or even weeks after use. Organs in the body have fatty tissues that absorb the THC in marijuana. In general, standard urine tests can detect THC several days after use. In people who use heavily, urine tests can sometimes detect THC for several weeks.
Many people who use the drug long-term and then stop have symptoms that are similar to those of nicotine withdrawal. Withdrawal symptoms are generally mild and peak for a few days after use has stopped. They gradually disappear within about 2 weeks. While these symptoms do not pose an immediate threat to health, they can make it hard for someone to stop using the drug. Because marijuana withdrawal is not as obvious or as painful as other drugs, such as opioids, many people do not realize that stopping marijuana use can cause withdrawal symptoms.
Although 34 states have some form of medical marijuana laws established, federally, both medical and recreational marijuana is still illegal to use and possess. The FDA has approved several medications that contain chemicals from marijuana. Unlike medical marijuana, this medication only contains the chemicals that have been tested and approved by the FDA to be safe for human consumption. It also comes with specific instructions for doses. In addition, several other marijuana-based medications have been approved or are undergoing clinical trials.
Marijuana is the illicit drug most frequently found in the blood of drivers who have been involved in vehicle crashes, including fatal ones. However, the role played by marijuana in crashes is often unclear because it can be detected in body fluids for days or even weeks after intoxication and because people frequently combine it with alcohol. Multiple studies have found that the risk of being involved in a crash significantly increased after marijuana use. In a few cases, the risk doubled or tripled.
Considerable evidence suggests that students who smoke marijuana have poorer educational outcomes than their non-smoking peers. For example, studies have found marijuana use to be associated with reduced chances of graduating. Adolescents who used marijuana often were significantly less likely than their non-using peers to finish high school or obtain a degree. They also had much higher chance of developing dependence, using other drugs, and attempting suicide. Several studies have also linked heavy marijuana use to lower income, unemployment, criminal behavior, and lower life satisfaction.
Studies have also suggested specific links between marijuana use and adverse consequences in the workplace, such as increased risk for injury or accidents. One study among postal workers found that employees who tested positive for marijuana on a pre-employment urine drug test had 55% more industrial accidents, 85% more injuries, and 75% greater absenteeism compared with those who tested negative for marijuana use.
Although scientists don't yet fully understand how the use of marijuana might impact the development of mental illness, high doses can bring on a panic attack or even acute psychosis. Marijuana can also worsen the symptoms of the severe mental illness schizophrenia, which involves symptoms such as hallucinations, paranoia, and disorganized thinking. Also, evidence suggests that early marijuana use may increase the risk of psychotic disorders among those at higher genetic risks for these disorders.
This slide highlights what is legal according to Michigan law for adult recreational marijuana use. Adult use meaning you must be 21 or older to use.
Those caught in legal trouble for using can expect to pay a fine and complete drug education classes or counseling. Youth can also experience school consequences like not being allowed to play on sports teams or detention.
Have any questions? Please don't hesitate to reach out to us.
If you or someone you know are in need of help quitting, here are some resources.